afternoon, and welcome to the 39th webinar of the Healthy Flint Research Coordinating Center. We are so excited that you've joined us today. My name is Yvonne Lewis, and I'll be your moderator for today. And we have a wonderful, wonderful session outlined for you. I hope that you'll just stay tuned through the whole event for the day. Just want to remind you that the Healthy Flint Research Coordinating Center is a multi-institutional partnership with community organizations and our universities. You can also see, if you're looking on in the webinar with us today, that we have a myriad of partners throughout Genesee County, as well as the state of Michigan, who have helped us put these webinars on for these 39 weeks. We cannot appreciate you enough for participating. And as always, I want you to know that our panelists are here in the background waiting to answer any questions that you might have. So I want to remind you, early on, if you have questions, go to that Q&A button, put your questions in now, and our panelists will be happy to respond to them for you. In addition, if you have questions and you're not able to access the Q&A because you may be joining us on your phone or you may be on YouTube, please give us a call at 810-835-2130, and we will be happy to answer any questions that you might have through our phone number. You can also go to HFRCC at info@hfrcc and put your question right into our on the website, and we will be sure to answer those questions for you. Today, we're using this format we started last week. We're going to have a roundtable discussion, and we just really want to do some real talk. Many of you have talked to us and you've sent us your questions, and we're going to try to respond to those questions. There are some things that are in the queue that we still want to respond to, so thank you for sending those questions in. But we're going to have a roundtable discussion first, and two of the questions that continue to surface are about quarantine and testing. So I'm asking our panel of friends, and we're going to have Dr. Deborah Verholden with us today, Suzanne Kupel, we have Dr. Susan Wolford, Jim Melanowski. They're going to be our panel today that's going to be a part of this roundtable. And I want to say hey to Melissa Sparks and Katie Baxter, who are also going to be presenters for the day, so they may want to chime in on this too. But the question is, what is this really all about? Oh, I'm sorry, Suzanne Kupel. Did I mention you? Everybody, this is Suzanne Kupel. She's going to be at this roundtable with us today. It is so important that we just talk for a minute about what's really going on with this quarantine and testing. I got a question for you. We've had some back and forth on whether it's 14 days, 7 days, and the CDC is looking at making some adjustments to their recommendations as far as quarantine. So let's have some real talk about it. Let's start off. Dr. Verholden, what do you say about this quarantine thing?
Well, I want to share with folks. I'm going to put something up in the chat, and it's just the new recommendations that the CDC has provided. Some brief recommendations to reduce quarantine time. Here's what I'll say. The 14-day quarantine is really the thing that maps onto the lowest degree of risk and the highest degree of protection. And so that's just what the recommendation has been. And in reality, that has been hard, I think, for many people to adhere to. And the CDC recognized that. I think we have many recommendations that we know are driven by science, but they're a bit tone deaf to the circumstances and the realities of what a lot of people have to deal with. So to that end, the CDC said, well, we know people are not exactly honoring these. We know they're having trouble. Let's add a little bit more specificity and a little bit more information to really inform people about effective ways that they could potentially reduce the time, but also to communicate to people that there is some risk that comes with reducing the amount of time in quarantine. So I think this was their attempt to meet people where they are.
Thank you, Dr. Deborah. Now I know CDC is our national, they talk for the whole country. They make these recommendations. But Suzanne, you work in our local health department. How are you dealing with this? And how do you interpret these recommendations that are being given by CDC?
So we're sharing with people that once that 10-day mark has happened, the quarantine can end if you do not have any signs and symptoms. But a key thing here is that you should be monitoring for signs and symptoms of COVID-19 from that 10-day to that 14-day period so that you are covering the full 14 days, taking your temperature and doing all of those preventive measures. And again, limiting your exposures. We recognize that not everyone in our community has sick time. So this has been a challenge for a lot of people, and it's truly exposed some of the real challenges we have, not having national policies that allow people to have sick time.
Thank you. Now, Dr. Wolford, Susan, we just real talk now. You work in a hospital, mamas and babies. What are they saying to you about what you're asking or what they're being asked to do related to quarantine?
So I just want to, I think re-emphasize what has been said, that while 40 days is the best. And in fact, we're just learning more and more about this virus over time, right? Because I remember when we first became aware of it in March, my nephew was in Italy. And when he came back on March 11th, we put him in quarantine for 21 days because at that time, there was information that maybe symptoms might take that long to come out. And we were not taking the risk of catching COVID from him. So there he was put. Now we know a bit more and we know that 14 days is optimal. But when we do that, it means that healthcare workers can't go back to work. Many people who need to go back to work or their services are required can't do that. And many of us are having a hard time staying to that 14 days. And so these new recommendations have come out. Along with it, the suspected increased risk that you might have. So if you quarantine for 10 days, then there's a little bit more risk than if you quarantine for 14 days. And if you quarantine for 7 days, there's a little bit more risk than that. So it's all a risk-benefit ratio. But certainly we all want to, when we shorten that quarantine, make sure that we're following the recommendations. We are checking our symptoms. And when we're out afterwards, we are wearing our masks, washing our hands, doing all the things that we know we need to do to protect ourselves and others.
So now, Dr. Wolford, you talking about this risk benefit thing. You give me so much more to think about, and so that from the perspective that you talked about, people can't, and even you mentioned this, Suzanne, that people may not have sick time, and that could be a long time. Jim, you're an employer, and you're working with individuals who are in the healthcare setting. How does this impact this whole quarantine? How does this impact what the organization?
Oh, it's been an unbelievable challenge. Myself and our management team spend so much time trying to figure out, okay, who's having symptoms, who needs to quarantine, who needs to test. And we don't have a lot of people working at our offices. Most people are able to work remotely. And so, but it's that constant shuffling of getting the feedback from people, whether they've tested positive or they know somebody who has tested positive. Then we have to figure out on our end, did they have any close contact with somebody here at the office? Who needs to go get tested? How long do they need to be out of the office for? It's really been one of the most challenging things that I've ever had experience in my days of leading an organization, because we certainly don't want anybody to get sick while they're here, but we also want to give credible information to people on where to get tested, how long do they need to wait until their results come back. All of those things that we talk about in these webinars, we want to make sure our staff is educated on them.
So now you bring out another important point, Jim, because we talked about the vaccines for the quarantine first, but now this whole issue of testing. How do you either to know you need to be in quarantine or you can get out of quarantine and all of that. So going back to you, Dr. Deborah, because you're the epi person here. But give us a little of that Debbie too, that Deborah talk in there. What's the real, the test issues? We talked about this, that it's taking a little bit longer because more people are now getting tested. But when you say I was exposed today, do I just run out today and get a test?
That's not a good idea, because the thing is, it takes a little while for enough of the virus to build up in your body for it to actually come up positive on a test. It's called viral load. And I've looked at some of the clinical spec sheets on some of the various tests. Most of the tests, there's two metrics for how well a test works. It's the sensitivity, which is the ability of a test to correctly identify cases, and then the specificity. And
So-
that's the ability of the test to correctly identify people who do not have the disease.
So Dr. Deborah, let me ask you a question, because you threw out that, and I'm gonna switch from Dr. Deborah to Deb. You threw out that metrics. When you say metrics, what do you mean there?
Well, if you know they're not overweight, you get on the scale, you look at your weight, you look at your measure your waist, you look in the mirror. It's the things that tell us information about how something performs relative to some desired goal. So our desired goal for tests would be 100%. We would want every test that we took to with 100% accuracy tell us if you have the disease or if you don't have the disease. But that's not how tests works. I can't think of any tests off the top of my head that has 100% accuracy. But we have standards, right? So people have talked about the vaccine. They say it's 93 or 94 or 95% effective. That's a really good metric for how well the vaccine will work. So as far as the testing, if you look at them, most of the tests perform about the same, somewhere around 5 to 8 days after exposure. So typically, if you've been exposed, somewhere between 5 and 8 days after you've been exposed, whether or not you show symptoms, the lion's share of the tests are performing as well as they're going to perform, right? It's like you're not going to get any better.
Okay.
And then in fact, what we know that happens is your body will start to fight the virus off. So it's like, we call it a bell curve. The ability of the test to say, yes, in fact, you do have COVID increases as the number of days since you were exposed increase. And it caps out between about day 5 and 8. So that is really the optimal window for people to get tested. Because then what starts to happen after that? Well, if you recover well, your body actually will fight the virus off, absorb it, and then the virus will no longer be in your system, which is why if you get a test 3 weeks after you were exposed, it'll come up negative. So there's a sweet spot in the timing, and the quarantine is related to that. In an ideal world, we want to test people at that peak period where they will test positive if in fact they are a case. And that is somewhere between about 5 and 8 days post-exposure. And the one caveat I want to say for that is that's based on the testing that we have sort of available now, and that's based upon what we know now. Because this is a new virus, we all got to stay nimble. We all got to stay abreast of what's happening. You know, I remember when there was a time when they said the world was flat, right? That was science, that was knowledge. And then some brave soul ventured all the way out to the end and didn't fall off the edge. And lo and behold, we figured out the world was round. Well, there are some things that we do know about this virus, and there are some things that we're learning. So if the question is, do I have to quarantine for 14 days? I tell people, if you can afford to, that would be the best thing. And people being able to afford to is not just the financial, piece of it. If you're going to lose your job, you may have to have a more specific strategy, but it should be well informed. You should be tested during that period where the likelihood of you testing positive is the best. You should be monitoring your symptoms. And if you have any symptoms, you need to pivot and go right back into quarantine until you can be tested and confirm that in fact you're negative.
Yeah. So Suzanne, I've heard you talk about you are out here because you're the health department. You out and about all the time, and you're concerned about your family. So how are you handling this testing for you in the role that you have as a health department official? Gotta come off mute. Unmute yourself, Suzanne.
I'm very careful. I make sure that when I meet with my family, we're outside, we're appropriately social distance, we wear a mask. I haven't had any indoor time with my family, so I look forward to the vaccines coming in a time frame where I actually be able to hug my family again. But I'm very careful because I am out and about, and I know that I'm more likely to have an exposure than they are. And so it's really important we continue to do all the things that we talk about: wearing a mask, social distance, washing hands, doing all of those things. But Deborah's really brought forward some great information about how the virus works. I think that's important for people to understand. And the more that we learn about the virus, the more things can be refined. And so Dr. Wolford talked a little bit about her nephew coming back from Italy in 21 days. We are learning, and we'll continue to share information about what we're learning about this virus. Most important messaging is if you're sick, do not go out and do not interact with other people. Stay home, recover, make sure you have no temperature for that 24-hour period without any fever reducing medications before you potentially expose someone else.
Thank you, Suzanne. And of course, I'm going to ask you, Jim, as an employer, but also, you know, you're trying to juggle what you do for staff. How are you juggling what you do for you?
Well, yeah, that's the challenge too, because as an employer, but also as just a person, you have to take this seriously, and you have to be cautious, and you also have to find those opportunities to get tested. It's not like I can just walk out my door and get tested. I have to find where those are at, what times, and we, you know, and so those are important things as well. So it's just being really ready and having those resources. Who do I call? Where do I go online to find the where I can get tested? So that's why the health department has that great site where you can go on there and find out what testing sites are available. And we share it on our website, so they can come to the Genesee Health Plan website. So those are the most important things, is being ready to do those types of things, and to get tested. And then what's my quarantine plan, or what's my plan with my employer? It's so important to communicate with the employer what's going on. Do you have symptoms? Do I need to stay home? And just having that dialogue.
Because we have families, you know, we're looking at each other, and we look all professional on this webinar, but we got families, we got friends, and so we're equally impacted about how to make these decisions that's best. And so we're just about at the close of this segment, but I want to just open up really quick for Melissa or Katie. Did you have a quick word that I see you leaning in that you wanted to say in this conversation, this real talk about quarantine and the testing?
I would just like to say, just to encourage people, and to recognize how difficult this is for everyone. You know, we continue to recommend that we follow all of these recommendations, and we appreciate the wisdom and the science and all this information. But we also have to remember it is very difficult on families and individuals to follow all those rules, and people are wary, and small businesses have been impacted, and there's a lot to it. So we just need to be sensitive and aware, and we want to make sure we're supporting people, not just their physical health, but their mental health. So that's important too.
You get that mental health in there, Katie. Thank you. And Melissa, you're going to come on a little bit later and talk to us more about the hospitals, but I just wanted to know if you had just one quick word you wanted to.
Actually, I feel like we'll round back to that, and I'm going to cover that in my little segment.
So we want you to stay tuned, because Melissa's going to come back. She's here with us today from Ascension Genesis. And I'm kind of mindful that, you know, when you do radio, sometimes people come in after you've gotten started. So we want to appreciate every one of you that tuned in to the webinar today, the Healthy Flint Research Coordinating Center webinar. And you can put questions in the queue. I see there's some questions in there for our panelists. So please put those questions in the queue. I look at Lawrence O'Donnell on MSNBC, and he says, you know, he talks about the last word. So I want to give I'm going to say Deborah and Suzanne an opportunity for a last word, because Susan Wolford, I'm going to switch. She's going to be Dr. Wolford in a moment, and we're going to do a segment about vaccines, flu vaccines. So Deb and Susan, last word.
Well, I'll just say, I think, staying abreast of the information is really important. So I just really appreciate, Suzanne and others for coming on each week and keeping us up to date. I personally did not appreciate the sentiment that we were somehow being protected by having information withheld. I think knowledge is power. And I just encourage people to be flexible, right? And just know that we are all doing the best we can. This is a conversation and a webinar of truth tellers. And so what people can count on is we will tell them the truth as we understand it, and we will share knowledge as we understand it and as we get it. And if something changes, we'll be forthcoming about that too. And so, because we told people for weeks, you can't test out of quarantine, because those were the recommendations. Now, I did have a lot of people call and reach out to me one-on-one. And I said, look, let me give you a little bit more nuance in the background around what the 14-day means, so you can make an informed choice if you choose to do something less than 14 days. So it's nice that the CDC is now sort of caught up to that and realizes that not everybody can do 14 days without some, consequence or some impact to them, and that they're giving us a little bit more nuanced way of thinking about it. But the most important thing is that people just stay nimble and stay informed, and we'll keep doing our job to make sure that they've got the hottest and latest and greatest information that we've got.
Thank you. Suzanne.
We know vaccine is coming, and we know that by the time we are ready to immunize our entire community, there are likely to be many manufacturers that are going to be approved for vaccine. So it's critically important that we have these conversations, share information, and allow people to have all the information they need to make the decision that is best for them, and recognize that everyone needs that information, and there's going to be a lot of information to sort through. So these types of forums are so important so people can get that information.
Thank you, Suzanne. And Jim, last word.
Last word is just, again, I think what we've talked about is just being knowledgeable, have a plan ahead of time, and just really communicate as an employer, communicate with your employer, and the employer needs to communicate with the employee as well.
Thank you. Thank you. And thank you all to this wonderful panel, Dr. Deborah Holden, and so many hats she's wearing, Susan Cooper from the Health Department, Dr. Susan Wolford from U of M, and also Jim Malinowski from the Health Department. Thank you so much for being a part of this roundtable discussion. Appreciate you, Katie. We'll hear from you later. Susan Wolford, Dr. Susan Wolford, we want to go to our presentation now. Dr. Susan Wolford has been considered, our expert panelist today on vaccines. And we've talked a lot about the vaccines, and I want to remind us as we're pulling this piece together, our goal with the webinar is to bring information for you that you can utilize in your everyday activities. So we're really trying to make this real, and sometimes people say numb it down or dumb it down. It's not about that. It's about making it relevant to where we are today. We've been dealing with a global pandemic, and we needed to understand how to make sense for us here in Flint, Genesee County, and others who happen to listen to us. But we're in the midst of a real interesting situation right now, because we've talked about influenza, the flu vaccine, for years. And so there's still been some questions about that. So Dr. Wolford, give us a little bit of insight. And then we want to talk about this because this is National Influenza Vaccination Week for the CDC, sponsored by the CDC. But first, can you just give us a little update on how this vaccine really works, something about it that we need to know that would clear up our understanding?
All right, so thank you, Yvonne, for this opportunity. If we think about the flu vaccine, I want you to think about flu like an orange or a tangerine, because it comes in different types, right? So what happens with the flu vaccine is that they either kill the virus and put that in the vaccine so that our body can learn how to fight it, or they greatly weaken the virus and they put that into our body so that we can learn how to fight it, or they take little pieces of the skin and put those little pieces into our body, and that's how we learn how to fight it. The reason why I said it's like an orange or tangerine is because they're different types of flu. And every year they have to decide which type of orange for influenza A and which type of tangerine for influenza B they should put into the virus. So they try to guess based on what types of the flu are being seen in other parts of the world the year before. And they guess which types it's likely to be this season, put that into the vaccine, and that's what we're given. If they've guessed right, then we're very, very well protected against the types of flu that are around in this season. If they haven't guessed right, then maybe it's not quite as effective, but it's still very. So because of that, we should go get our flu vaccine if we haven't gotten it yet. But I hope everybody on this call has already. But if you haven't, now is the time to go and get it so that you can be protected against flu.
Thank you, Dr. Wolford, because you brought us to the understanding, because I've never seen that. That's a great example. Tangerine and the orange are still in that family. So the viruses, that's why sometimes people say, well, I got the flu vaccine and I still got the flu.
If they got the flu vaccine and they still got the flu, first of all, are they sure they got the flu? Because they could have gotten the cold, they could have gotten something else. They certainly didn't get the flu from the vaccine because it cannot give you the flu. But it could be that year we didn't guess it quite right. And so indeed, it wasn't the best protection against the type of flu that was around that season.
Yeah, so it's like I often share it, and people have heard me say this over time. I use the weatherman analogy. They'll tell you partly sunny, partly cloudy. You know, this is what we anticipate, and we're doing our best, but something might change. But one of the things the CDC has recommended, and you see here, it's National Influenza Vaccination Week. The first week in December, there's a real push, and this year it's December 6th through the 12th, a real push to get people immunized. Like you said before, you're hoping that people have gotten it by now, but many people may not. So the reason that this is put forward this week is because we're just getting ready for the big holiday season, Hanukkah, Christmas, all of the other celebrations that people will have where we normally get together. And the idea was that if we get vaccinated during this week, it'll give our bodies enough time to build up immunity. So can you talk about that a little bit, that time frame?
Right, absolutely. So remember I said that we're presenting our body with this either killed or weakened or parts of the virus so that our body can learn how to fight it. Well, it takes some practice. And so it can't, if you give it today, it won't be able to fight it off tomorrow. So it takes a couple of weeks for your body's immune system to have gotten that practice in and ready to fight the real virus when you come in contact with it. So that's why we have that little bit of a delay between the time that you get it, the shot, and the time that you're really protected against the virus.
So now a few years ago, and still there was a real push to increase the number of vaccinations that were received by minority groups, particularly according to African American, Native American, Latino, Hispanic. And this was because the rate of uptake or actually having the vaccine was lower in our communities. And a lot of it had to do with the myths and really fears of getting the vaccine. So can you just real quickly talk about these differences in racial utilization of vaccines and why it's important for us to do something different today?
So I think it's really very, very reasonable that people should have concerns where it comes to putting something into their body, right? We know that in the past, African Americans and other groups have not been treated ethically, and so therefore there are concerns. I would say in regards to the flu vaccine and in regards to vaccines in general that we have today, we can trust them. We know that they have been tested well. They have been tried and true. They are not going to, everything, has a risk, but the risk is very minimal. And so we, as African Americans, we as residents of Michigan can feel safe in getting the vaccine, and it will protect us from having to end up in the hospital from a bad case of influenza at a time when the hospitals are full because of COVID, because we don't yet, although soon will have vaccine protection. And I know we're going to talk a little bit more about the vaccine protection from COVID in weeks coming. And that will be important because we need to still keep doing all the things we need to do to protect ourselves, even once that vaccine comes out, because not everybody will have it right away. as well will take a moment to become, for our immune system to be able to fight things off. And just to put it in context, I will say that with the COVID vaccine, think of a pineapple. It has all of these spikes on it. And what's really interesting about the COVID vaccine, which we'll talk about more, rather than taking off a bit of the spike and putting it in us so that we learn how to fight it, COVID vaccine, that one, it gives us the blueprint of how to make the spike within us so we can learn how to fight it. So it's a different way of actually protecting us, but we'll talk more about my fruit bowl next week.
You're so right, Dr. Wilford. We're going to need to talk a lot more about that fruit bowl you got going on over there. So I want to ask Jim Melanowski. He was on with us earlier, CEO of the Genesee Health Plan, because the coronavirus vaccine is coming, but today we have the flu vaccine available. So Jim, can you just kind of give us what's happening at the health plan today?
Yes, starting at 3 o'clock to 6 o'clock, we have made it very easy for people to, if they have not gotten their flu shot yet, as Dr. Wolford talked about the importance of that, they can stop by the health plan and they don't even have to get out of their car. They can simply come in. We have garage bays that they can pull up, just like an oil change. They roll down their window and a pharmacist will be there to give them a flu shot. And what's great is our partners from the health department are going to be here on site as well. And so if a person needs a pneumonia shot or a vaccine or a Tdap vaccine or others, those types of vaccines, they can come inside and get those done through the health department. So really, if you aren't, and what's nice about the health department is they can also look those things up. They can go on the computer and see if you've had those vaccines. Which is really good. They caught me once at an event. I didn't realize. They stopped me and I got caught up with some vaccines that I was due for. So I would really encourage people 3 to 6 at the Genesee Health Plan on Linden Road.
Thank you, Jim. That's today from 3 to 6. So you can get your vaccine. Now we have another partner who is also recognizing this week, but they're going to do their events on Monday and Tuesday of next week. And Clarence got called to another meeting, so we're going to just promote this for him. Clarence is the CEO of Hamilton Community Health Network, and they're also doing free flu vaccines and a turkey giveaway, and it kind of one-upped us. We don't have turkeys today, but we will have a nice gift for you over at the health plan. But December 15th, Tuesday, from 9 to noon at their North Point Clinic, which is on Clio Road, they will be having their flu vaccine event and turkey giveaway. And then on the 17th, which is that Thursday, at the Burton Fire Station on Bristol Road from 1 to 4 p.m., they will also be having flu vaccines and a turkey giveaway. So we've partnered together, and I say we because we're all working together. As you can see on our poster, our banner there, Hamilton is one of our partners, the health plan is one of our partners, but we also have the Hurley Medical Center, the HAP Alliance plan, and so many that are coming together to make these opportunities available for you in the community. So please take advantage of these today. Call a friend, call a neighbor, and let them know these opportunities are available. Let's take care of this so that we're as protected as possible for the holiday season. Now, Dr. Deborah, I see in the Q&A, there's a question about policy, and you've worked with the Flint Center for Health Equity Solutions to develop a policy brief around this issue of COVID. So can you give us an update on what's happening with the policy brief? And I want to make sure our panelists know, please answer the questions that are in our Q&A today.
Sure. So one of our fabulous staff, Mary Catherine Crawford, who's a Flint native, fairly recent, within the last year, graduate from GW School of Public Health, has her MPH. She has aspirations for moving in the policy space and has taken up the mantle to do this work. It's a partnership with the health department. And I want to again shout out Suzanne Kupel for all the great partnership, and not only to help us get data, but to help us make sense of that data. Because as we all know, this season is calling for a whole lot of resources and mandates and policies and strategies, oftentimes that have to come from people who aren't steeped in that. They don't have expertise in vaccines. They don't have expertise in epidemiology. They don't understand. Many of us, how many people didn't know what a pandemic was before this? right? You probably never even heard the word because it's not sort of in our everyday vocabulary. So this is really our attempt to kind of take what's happening, bring it down to a level that is understandable, and most importantly, that's actionable. So what you can see here, and what we've chosen to highlight this week, is to just show how geographic spread has changed between October and November. So the darker the color, the more cases there are. And as you can see, in October, we've got a lot of lighter blue, we've got a lot of white space. And if you look in November, there's no white space anymore. And quite the contrary, the intensity, the density, the number of cases in each of these communities is increasing. We know a lot of that is the Thanksgiving phenomenon. We're now really just understanding that Thanksgiving phenomenon. Why? Because let's say you were exposed on Thanksgiving Day. If you were exposed on Thanksgiving Day, again, go back to the testing example, it would take 4, 5, 6 days before you would actually test positive. So you've got to then go get a test. And sometimes you have to schedule an appointment. So if you wait the recommended 4 or 5 days following exposure before you get a test, you got maybe have to wait a day or two to get that test. And then depending on what demand looks like, some people are getting their test results back in 2 days. For some people, it's taking up to 2 weeks. Again, knowledge is power. Knowing your status is so important in this time. And if you don't know your status, it's important that you do all that you can to get yourself out of harm's way and get others out of harm's way by going into quarantine. So basically, Houston, we got a problem. Like when we were at the height and we thought things were the worst back in March and April and May, we're now 3 and 4 times those case counts. And so a couple of things I want to point to. Number one is we've made tremendous strides in narrowing the gap in disparities that we saw in COVID. We focused on the Black-white disparity because that was really the striking one, the one that caught the media, but there are many vulnerable among our population. That includes people living in group homes and in care facilities, our seniors, people who are immunocompromised, people with pre-existing health conditions, people without health insurance, people who are unstably housed. And so it's really important that we all do our part to prevent community spread. And we've made a few recommendations. I want to acknowledge our federally qualified health centers, one of being, which is Hamilton Community Health Network, as well as I believe it's GHS, right?
Genesee Health Center.
Say it again.
Genesee Community Health Center.
Genesee Community Health Center. They've been, as well as our hospital partners, have been at the forefront of providing care. And we know that they have been a big part of why we've been able to bring down the rates in our community and also narrow those disparities. We've got a few data issues that we're trying to grapple with, which is we've got a lot of these tests that are coming back and they don't have data on race. They don't have data on insurance status. What we really want to do is sort of improve our precision when we're testing people and when we're getting data so that we can really know what's happening, who's most impacted and who's most at risk, for the important reason for them being able to implement solutions that map onto the problems. And we're working on that. And I just, again, acknowledge our tremendous partners at the health department. Yvonne, you'll be added to this because we need some community input on this as well. And just our tremendous team that's led by Dr. Rick Sadler. And again, the partnership with the health department to be able to do this work. So we're giving our policymakers what they need to make informed decisions.
Thank you, Dr. Deborah. When we talk about policies and we talk about the increase in the COVID impact in terms of our community, this leads us to understand what happened, want to understand what's happening in the hospitals. And many of you have asked us to address what's happening in the hospitals. So today we have a new guest with us. We mentioned her earlier, Melissa Sparks, who is a regulatory and compliance and accreditation person at Ascension Genesis Hospital. And so we welcome you, Melissa. Please give us the insights. One thing I found very interesting, which I really appreciate that you said, is that things are changing quickly. And so you just wanted to give us an update on what is happening right now that can help us know how to interact with the hospital. So thank you for being here.
Yeah, no problem. It's great to be here. I do want to thank Dr. Holden, because you made such a wonderful comment about knowledge. Knowledge is power, and to be flexible, because truly what I'm here to do is help understand the why we have visitor restrictions, what are those restrictions here at Ascension Genesis, so that people can understand where we're coming from, what we're doing to keep our patient population, our caregivers, and our visitors safe. Go from there. So on November 18th, we did institute our most current temporary visitor restrictions here. And that is because of the community spread, the wide community spread. We need our healthcare workers here at work, and we need them safe to take care of people that are coming in. And we want to make sure that those people at home that are caring for their loved ones are safe. So in looking at that, we have what states as no visitors currently. Now, there are some people that are allowed to visit right now. Currently, unless it is end of life care, we are not allowing any visitors with COVID positive patients or those suspected with COVID. We do allow one visitor with those 21 years and under, one visitor for outpatient surgery, but they must wait out in the surgical waiting lounge. One in the pediatric unit, one guardian there, one for outpatient radiology and lab, and one visitor may come in for those that are in our ICUs or those that are in our general medicals that are deemed to be incompetent of making decisions for themselves, if you need to make those medical decisions. However, there are exceptions that can be made to this. They're rare and few and far between, but we know that we need to be flexible and that there are some exceptions. But we really are using technology. We do have access to tablets. We encourage that for FaceTime calls. I will tell you that it is very hard. My mom just did a 5-day stay here in the hospital. And to be here and to know that she was downstairs in one of our units and that I couldn't go visit her, it was very hard. But understanding the why, that I want her to be safe, I want myself to be safe, we want to decrease that foot traffic, really helped. Along with that, so if the kind of experience that you would have here at Ascension Genesis, so when you come in, everyone gets screened. All of our associates, our providers, our vendors, as well as visitors, those coming in for appointments, everyone is going to get screened. So you're greeted right there at the door, and then we ask you a series of questions, and they end up being 2 yes or no questions. Signs, symptoms of COVID is one of them, and if you've had a recent exposure. If it's yes to any of those questions, we do ask that, actually, we have you not come into our facility. And if you are allowed in, what we ask is that you keep your foot traffic to a minimum. We want you to stay with that person that you're with. We want you to stay in the patient's room. We don't want you, coming down, making a ton of walks. We want to make sure that you're practicing good hand hygiene and that you discuss any questions you have with the care team. Also, we are allowing you to wear your mask into the facility, but if you haven't brought a mask with you and wear it right in, we will provide you with a mask, and we encourage you to do that. Other than that, Yvonne, did I kind of hit on the things that you wanted me to hit on? Oh, you're on mute there, Yvonne.
I'm sorry.
That's okay.
Can you hear me now? Yes, Melissa, we just wanted to make sure that our listeners and those of us that are reaching out and helping our community members understand that there is a process and that they're ready to follow that process when they get to the hospital. And it is for the protection and safety, not only of that patient, for the staff and for them as well.
Absolutely. Absolutely. We're here to answer questions and to make this a really good experience for all of those. We know what a trying and difficult time it is. And so we're doing our very best to make that experience still a positive one with us in these trying times.
Thank you so much, Melissa. We appreciate you being here with us, and always feel free to come back and share with us There are questions in the queue, and maybe, as you said, someone might have a question specifically for you. So we're asking our participants again, please put those questions in, and we'll make sure our panelists can answer those for you. And if not, we keep them in our queue so we can answer those questions going forward in our webinar. So thank you.
You're
We-
very
we're gonna,
welcome.
yeah, we're gonna make a quick adjustment, and let's go right to, I want to talk to Katie. I want to talk to Katie for the next 10 minutes because Melissa, you shared about the challenges about maybe not being able to be with that loved one in the hospital. And that brings about a little bit of an emotional stress for not only the patient, but for the family members. So I think you just led us to a good place to talk to Katie a little bit about how we deal with this from a mental health perspective, but also in preparation for the holidays. This is a lot for us to have to think about. So Katie, please share with us your tips. And I know you've got a wonderful exercise for us.
Well, thank you very much, Yvonne. It's always a pleasure to come here. Thank you for allowing Genesee Health System to have a presence and talk about mental health because it is so important. So thank you so much.
You're welcome.
So if you go to the next slide, here's a little picture here of this little guy, and just reminds us that not everybody feels the joy of the holidays. We think about the holidays, people say, oh, Christmas is the most wonderful time of the year, and all these songs and all this stuff about joy. But I want to remind people that there are times and individuals that experience a lot of challenges during the holiday. And there's a lot of reasons for that. There's various reasons, but I want to normalize that and recognize that not everybody does experience joy, and there can be difficulties for people. It could be for ourselves. And if we have a mental illness, we're particularly vulnerable during the holiday times. Some of these reasons why is just the stress of the holidays, purchasing that right gift and attending the events I need to go to, and making sure I get everything done and I get the meal prepared, and all of these things. They take a lot of time in addition to all the other responsibilities we regularly have. So it's a lot of stress on us. There's also a lot of pressure about, to whom we buy gifts, and picking out the right gifts and all those different kinds of things. We put a lot of pressure on ourselves on getting pictures taken and Christmas cards and baking and whatever these things are. There is often a lot of pressure on us, so it can be very difficult times. We also face economic struggles. Many people have been impacted from the pandemic in economic ways. People have lost their jobs. People are laid off. There are a lot of different challenges people face this year more than ever. But the holidays can always be a difficult time because many of us don't budget for the holidays, but when it comes up, we sure want to buy those gifts for people we love. And so that can be very stressful for us. Also, it's a time that we worry about our health and the health of other loved ones during this time. This is a unique year that many of us have know people who have acquired COVID-19, and some of us, unfortunately, know individuals who have passed and are impacted by that. And there's a lot of stress and worry. And I'm hearing more from families and parents saying, my child is worried, he's stressed, he's having panic attacks and these kinds of things, because there is so much information out there and so many people have been impacted. So we need to be mindful of these things. So I want everyone to be aware of that. NAMI, National Alliance on Mental Illness, reminds us that people with mental illness are particularly vulnerable. 64% of people with an existing mental health challenge. The holidays is even more difficult for them. So it doesn't get better for them, it gets more difficult. And often individuals with mental health issues don't have the same level of natural supports that you and I may have. And so they don't always feel connected and feel joyful and feel that they're going to receive or be able to buy gifts for other people. So it can be a difficult time. So I want to recognize that, and I want us to think about being sensitive to ourselves and kind to ourselves and kind to others during this time, so we can make it a joyful time. One of the things I want to point out is the issue about having control. And I think that's one of the things that can really cause us to be upset or dysregulated when we feel that we don't have control over things in our life and we feel a lack of empowerment. So, one of the things we can do is to look at ways that we can have control. And what are the things that I have control over? So, I cannot control my relatives and what they think and what they're going to do, and even my children or close loved ones. But I do have control over what I do and what I say and the way I perceive the world. So it's really important, and it gives us a lot of sense of empowerment to put the control in our court, so to speak. So I want to talk about mindfulness for a couple minutes here. Many of you know about mindfulness. Some of you may practice mindfulness. It's certainly a buzzword you hear around and see on magazines and so forth. But mindfulness is something that can be very valuable and really help us with our mental health. So the definition here is mindfulness is being fully present in the moment. So not in the past, not fretting about the past, and not in the future, worrying about the future. It's in the present moment, aware of where we are, what we're doing, and sensing, aware of our senses. And there's a biological connection to that that helps regulate our body when we get in tune with our senses, and not being overly reactive or overwhelmed about what's going on around us. So it's really an opportunity for us to develop a way of looking at the world and a way of experiencing the world that helps us to appreciate and experience the moment. Mindfulness is something that is very easy to learn and it's very easy to practice. It's not complicated. It's easy. There's lots of ways to do it. And in a minute, I'll give you a few different little tips about mindfulness. But the thing about mindfulness is it's very effective. It's evidence-based. There's quite a bit of research about mindfulness and the many benefits to it. So I'll talk a little bit about that. And if you're interested in those kinds of references, be sure to reach out to me because I can give you more information about that. On a high level, some of the benefits of mindfulness are decreased stress. Individuals who practice mindfulness talk about how they manage their stress better, and it allows them to deal with what's going on in their life in a much more productive way. Mindfulness also allows us to really deal and cope with illness and even facilitate our recovery, because when we're taking care of our mind and the way we handle things and perceive things and react to things, it affects our body. Many of you know, and I can't stress it enough, how important our mental health is in addition to our physical health and how they go together. You can't separate them. Our mental health goes with our physical health. So it's very, very important. Mindfulness can help us decrease depression and signs and symptoms of depression. Many people who report depression after learning ways to practice mindfulness and practicing mindfulness on a regular basis report that they improvements in symptoms of depression. And also our overall improved health, because when we're taking care of our mind and we're taking care of our body, and our body's responding to a regulated sense of emotion, then our overall health is improved. So there's a lot of benefits to mindfulness. So I want to encourage you, if you haven't practiced mindfulness, to learn a little bit more about it. And this is just a little sneak preview, and to find ways to practice it. Some of the things related to mindfulness are the way we look at the world. And I want you to think about mindfulness is not just a practice. It's not just, I'm just going to meditate. Mindfulness really is a way of life, the way we look at other people and ourselves, and how we live our lives. So these are some things about the holidays. One thing to keep in mind is don't overdo it. We spend so much time doing this or doing that that we miss the moment. And so if we can find ways to carve off some of the things that we do or used to do that we don't need to do, and then it's a good way for us. One of the things I did for many years, I have 7 children, and for many years I sent out all these Christmas cards and I did all this. And one thing I learned is it took a lot of my time and it was a little bit of a frustration. And I found other ways to share pictures and things without going through that practice. So it's just one example of if there's ways you can shave things off that give you a little more time to enjoy your family in the moment. Also, take time to enjoy the process, not just the outcome. I'm checking off my list that I get it done, but really enjoy that time. And, the Christmas cookies we're making don't have to be perfect, but we're making those with our children or somebody else, and we can really enjoy that. And we can think about in that process, actually, one of the things people do in mindful, it's called mindful eating, is when you take a time to really enjoy your food and you chew it slowly and the taste of that and the smell of that is just a little thing to bring us into the moment. Reduce the time on screens. I've said this before, and social media and other kinds of things, because too much of that can be upsetting and not helpful to us. And we don't have to worry if we're going to miss every little thing. Put the phone in the drawer or set it down for a little bit and then come back to it. And it allows you to be present during the time you're spending with your family. Speaking of spending time with people we love, the connection is really important. And we could do this virtually. It doesn't have to be face-to-face with people. We can still connect. But many of you can think of somebody you talk to, and when you're talking to them, they're fully present and they're listening to you, and you can see the eye contact and they're acknowledging you. And then there's times when you're talking with them or maybe somebody else and the phone's out or they're looking away or they're doing something different. So just really, if we could practice time with the people we love and care about to really listen, we can really find benefits of how those relationships can really flourish. Also, this is a good time to try something a little new or different. Some of us do have downtime or working from home, so we don't have travel or whatever. So it might be a hobby or something that you wanted to do that brings you some joy or you had some interest, to go ahead and take that up and think about that practice and what that's like and experiencing that. Pictures. We love pictures and they're wonderful. We like them on our walls and our phones and everything else. But sometimes we want to take so many pictures that we totally miss the moment of the experience. So don't make that the picture taking become about the picture taking, but really about capturing what that moment is and experiencing that moment with people we care about. Take time to play. Play is so important. People who are healthy and well, you'll find out they usually have a good sense of humor. They take time to play. We can get out and build a snowman with our loved ones or ice skate or do something fun and just enjoy the holidays and enjoy the time. It doesn't have to be perfect, but it can still be wonderful. I want to talk about gratitude is so important, the importance of gratitude, that the more we practice recognizing the blessings we have and the good things that we have in our life, that evokes a lot of positive emotions for us. It's so important. So just practicing every day, what is one thing that I'm grateful for? And when you practice that, find out, try it even for 1 week and see if that makes a difference on how you look at things a little bit. So it's a real important, helpful practice. So keep in mind that mindfulness gives us a time in our lives when we suspend judgment of ourselves and others. We're kind to ourselves and others. Sometimes we are the hardest on ourselves. It's not other people, but we beat up ourselves because we didn't do this or this right or that. So suspend judgment from ourselves and others and unleash our natural curiosity about the workings of the mind, approaching our experience with warmth and kindness to ourselves and others. So I just want to remind you, that even 2 minutes a day of practicing mindful activities can reap a lot of benefits for us. So I want to remind you of that. And lastly, I want to let you know that, remember, Genesee Health System is here for you. We can practice all of these things and learn these skills, but sometimes we still need help. Please reach out to us if you need help or a family member does, because we are here and we want to help you. Thank you so much for your time.
Thank you, Katie. And that really brings us to the close of our session today. We have got to remind you, because we're committed to our time. There's so much. I want you to go back and look at the webinar. Please get your CEU request in. Know that we're going to be back here next week for you. And there's some more wonderful things that we have to share with you. Like us on Facebook, subscribe to our YouTube channel, and please send us your questions in at info@healthyflint.org. We want you to complete that evaluation, because that information helps us every week make sure we can bring the best information to you absolutely possible. Join us next week, December 18th, for our next community webinar on coronavirus. We appreciate you and look forward to next week's session.
And Yvonne, just before we end the live, can we just go back? Only because we have one time sensitive opportunity here.
Oh, yes. Thank you.
Let's go back.
So
So we have a business opportunity for small business owners, and the deadline is December 15th. So whatever plans you had over the weekend, if you have a small business of 15 or fewer, I encourage you all to go and check it out, and don't let this opportunity pass you by. We have Moses Bingham on from the Community Foundation, Community Foundation of Greater Flint. He's the Director of Special Projects and Initiatives. There's a time-sensitive opportunity that's available for small businesses, 25 employees or fewer. Go to metrogrants.com, metrogrants.com. It's first come, first serve. So people still have a few days. Get those applications in and get that good money and keep your businesses solvent and meet any of your COVID needs.
Thank you, Dr. Deborah. And I know we normally end at 1 o'clock, but we have like how many people still on with us? Of our attendees, there are about 59 more people that are still hanging in there. So I know they are listening for that additional information. So thank you for raising that. We also know that Gary Jones was on with us today. Continue to just connect with him as well. So all of our panelists, we appreciate you so much for being on with us today, and we look forward to you being here next week. Just as a tip, some people ask, Dr. Deborah, Dr. Wolford, are we going to be here on Christmas Day and on New Year's Day? Well, all we want to say is we got something to plan for a holiday chat. We'll see what that looks like. But you can send us a note to our email, or put it in your email. What say ye? Those of you that are still on listening, what would you like to see for the next couple of weeks?
Yeah.
So, all right.
Bye.
So, thank you all so much. Have a great weekend.